On the initial consult visit, that is the first time I get to meet the patients. This is a time for me to get to know them, and this is the time for them to get to know me, and to make sure that we have the same philosophies and we kind of can work together. It's also a time for me to sit down and ask questions about their history, their family history, their surgical history, their medical history, any labs or workups they've already done with their gynecologist, to identify gaps and to identify areas where we need to further investigate, to look for red flags and to make sure that we leave no stone unturned in our evaluation so that we can have the proper diagnosis and the proper treatment. It takes about an hour. We ask about their previous pregnancies, we ask about their family history of cancers, fertility history, any history of miscarriage or previous pregnancies and how that went. We look at previous fertility treatments because some of these patients have had treatments with their gynecologists with less aggressive treatments. Some of them come with a stack of a thick chart with prior treatments with other fertility specialists. So we spend that time to review that information and to see what we should do, what can we do better, and maybe reinforce what has been already done right. At the end of that procedure, that time period, we then have identified the testing that needs to be done and things that need to be done. They're all put into the computer so that the next time the patient comes, which would usually be on their period, we can then proceed with the plan of doing the testing that is required. Once we've done that, we usually ask the patient to come back on the first day, second or third day of their menses to evaluate their ovaries by ultrasound and count their eggs, called antral follicle count. We will do blood tests to evaluate their hormonal status for egg quality. We will schedule them for an X-ray of the uterus and fallopian tube, usually on day 7 to 10 of their cycle, to look at their fallopian tubes and uterus. We will schedule their male partner, if they have one, for a semen analysis with 3 to 5 days of abstinence. And once all those tests are complete, and any other tests that we would deem necessary, the patients follow up within 2 to 3 weeks of that initial blood evaluation for a follow-up to review all the test results to determine what the cause of their fertility is and what potential treatments would be best for them.